asking me to come in and share. So for me in this session, I would really love for it to be as interactive as it can be. So if you have any questions, please feel free to pop them in the chat. I think at the end, hopefully we're gonna have some time at the end as well for everyone to, unmute and to ask any questions that they may have. So I would really, really like to welcome you to this session, and please be free. There is no, as people always say, there is no stupid question. Every question is valid because it needs an answer. So be free to ask your questions. Be free to share your opinions, your thoughts, or any comments that you may have. We're all here to learn, and I'm here to learn from you as much as you are here to learn from me. So I'm going to switch off my video so that you guys can focus on the presentation. But yeah, I hope that it's going to be a very fruitful session for everyone. So as has been mentioned, my name is Netemba Gwambe, and by profession, I am a counseling psychologist. Okay, so the objective of this session basically is for everyone here to understand the different psychology categories. We're going to look at the autobiography and what is required or needed from you. We're also going to look at the research proposal, the structure of it, basically, what it is that you need to know, how it is that you need to structure your research proposal. We're also going to look at tips, the do's and don'ts for your master's application. And then lastly, we're going to look at the importance of self-reflection, because self-reflection is basically one of the most important tools in my own understanding or in my own opinion of being a counseling or a clinical or industrial or whichever category of psychology that you're going to choose for yourself. The ability to self-reflect is very much important, especially if you're going to be dealing with clients or patients. So that is basically the objective of this session. So a little bit about me as an icebreaker. As has been mentioned, I am a registered counseling psychologist with the Health Professions Council of South Africa. I currently work for UKZN Student Support Services. I completed my master's degree at the University of the Free State. I did my undergraduate and my honors at the University of KwaZulu-Natal, and then I decided, you know what, I need some change. Let me go somewhere else. So I decided to go to the University of the Free State. And it took me about 9 years to complete my psychology journey, which I think is a shock to a lot of people when I tell them that, because the journey to become a psychologist is about 6 years. And I think I share this because I want everyone here to understand that your journey is going to be different. The minimum is 6 years, but it doesn't really look like that for a lot of people. For me, it took me 9 years. So the reason why it took me 9 years is I did my undergraduate, record time. I did my honors, record time. Then I got into masters my first try, right? So I got into masters, and I think I was about 22 years old when I got into masters. First year of masters, it was okay. I managed to get signed off. Then I went on to do my internship. Internship was okay as well, even though it was during COVID, but I managed to be signed off. So the real obstacle to my journey really was my dissertation. My dissertation really took quite a bit of time for me to finish, simply because I didn't spend as much time on it as I should have spent, especially during my internship year. So by the time I was finished with my internship, I wasn't done with my dissertation. And there was a whole back and forth because I had to change my topic. And then after changing my topic, you have to get ethical clearance. And that took about probably the whole of 2023. No, not 2023. 2021, yes. It took about the whole of 2021. And then it was only in 2022 where I started doing my write-up. So luckily, I didn't need to collect any data. So I spent a lot of 2022 just doing my write-up, and I only submitted my final draft in December. And then I got my feedback including comments regarding my dissertation in Jan. So I only graduated in 2023. So that's my journey. And as I said, that I'm sharing this because the journey looks different. For some people, it takes a lot longer for you to actually get into masters. For some people, it takes longer to get out of the journey, to write your board exams, to finish your internship for whatever reason. So I really just want to normalize the experience. Not everyone's experience looks like 6 years. Some people's experience, it takes about 9 years. There's nothing to be ashamed of, because it is your journey. And throughout that journey, you are learning something about yourself, right? And then my next obstacle came along with my board exam. So as I mentioned here, I wrote my board exam twice, right? So the first time around, I wrote my board exam. I felt like I was prepared, but when I stepped into that exam venue and I started answering those questions, I just knew it. I knew it. I was like, Sneh, you are not going to pass this. I could feel that I didn't pass it. So I failed my board exam the first time, and that was in October, and that was crushing, right? So even though mentally I somehow knew that I didn't do well, but it was still crushing because this journey has been so long, it's been so challenging, and I just wanted to finish and I just wanted to call myself a counseling psychologist finally, right? So that didn't happen, and I had to reapply and write my board exam again in Feb. But it was not easy to get myself back into that mental state of, okay, I need to study, because I'm still nursing my emotions. I'm still like, okay, what is happening? Like, why is this not, working out? I wasn't questioning the the choice of becoming a psychologist. I'm just questioning the journey. Like, why are there so many obstacles? But regardless of that, I managed to pick myself up, and then I wrote my board exams in February. I passed my board exams last year, February, and then I managed to do all of my applications to become an independent practitioner, and I registered with the council. I think it was in May. So I'm coming up to a year right now of being a counseling psychologist. So for me, I've always wanted to be in a career where I am of service to other people. It wasn't necessarily becoming a psychologist. I just knew that I wanted to help people, which I think is a reason that a lot of us use when we're applying to master's application. When they ask, okay, why do you want to be a psychologist? We're like, I want to help people. But I think it's important for us to kind of go deeper. And I think I am going to ask that question probably in the next slide or something like that, of why it is that you want to be a psychologist. But I think for me, the interest really came in high school. I think it was in my matric year where I wanted to become a peer helper. Basically, you're someone who listens to other people's problems. And I was really drawn to that. I started being drawn to mental health because I wanted to understand the why. Like, why do people behave that way? Why do certain things happen? Why do we think like this? And that was due to my own life experiences, right? So this is just basically like a snapshot of how it is that you need to answer that why do you want to become a psychologist question. That yes, you can say that I want to help other people, but there needs to be like more meat to it. You need to go in a little bit deeper and really understand like, okay, what is it? Is it because I want to understand, mental disorders? Do I have I seen, mental illness around me? And, that's kind of the reason why, I'm drawn to this career. And lastly, I'm still figuring out my path as a psychologist. And I think that is normal. Some people know what their interests are right now. I am just still figuring it out, and I'm taking it one step at a time, basically. So that is about me. And yeah, so my icebreaker is, wait, let me just move this. And please feel free to write in the chat. I'm not sure if I can see the chat. I don't think I can. So Tato, if you can, just help me out with that. Or if you want to unmute, please raise up your hands and you can be unmuted. So my icebreaker is, what are some myths that you have heard about either the application process or about masters? anyone is open to share. As I said, that this session is all about um, it's all about you guys as much about me sharing. I would really love to hear your opinions, what you have to say, so please feel free. This is a non-judgmental zone. We're not here to judge each other, we're not here to laugh at each other. We're here to share about something that is really important to everyone here, which is getting into masters and becoming a psychologist. So, what are some myths, if you have heard of any myths about the application process or about masters, or what are some fears that you have about applying?
Okay, we have patience in the comments. She said that getting in from first time application is hard.
Okay, yes, yeah. As I said to you, Precious, that I got in the first time around. So that's definitely a myth. That is definitely a myth. For some people it takes longer, but for some people it doesn't take that long. So I got in the first time I applied to masters. Thank you for sharing. Anyone else? Okay, I see a hand. You can go ahead. Please say
Hi.
your name. Please say your name before you speak.
Okay, my name is Buchiro.
Hi,
Um,
Butilo.
Hi. One of the myths that I've heard about masters, the whole process is you must have experienced trauma for you to qualify, or yeah, to be the best candidate. You must have experienced trauma.
Okay. That is definitely a myth. I don't think that's a requirement, that you need to experience some sort of trauma. I know people who have not had any traumatic experiences in their lives and they got into masters. So that's definitely a myth. Okay, I see Tabi Singh as well.
Hi, Shmita and everyone. My name is Ntabi Singh, and the one thing that I think I've came across a lot is that during selection week, you shouldn't be extroverted, you shouldn't be also introverted. In fact, they always say that introverted people, I don't know, they participate less, and it makes it difficult for them to get into the program. So yeah, that's just one thing that I've heard as well. So I don't know if it's a thing of you need to find balance, or but I do know that you need to be yourself.
What's happening? What's
Yes.
happening here? Come pick this bread. I cleaned and you mess.
Sorry, Butilo, please could you mute? Sorry. Um, yeah, I think you've just hit it on the nail that there needs to be a balance, right? Because I'm an introvert. I'm very introvert, not very introverted, but I'm an introvert. And I knew that during Masters Week, in order to maybe stand out, I needed to participate, especially in like the group sessions. You need to be able to contribute because when you are doing your masters in your master's class, it's like probably six of you or 12 of you guys, and you probably have conversations and you need to be able to contribute to the conversation. So I think that's what they're looking for. They're looking for people who are able to contribute. Yes, you can be yourself, but also, try to break out of that introverted side of you and, answer questions, contribute to the conversation. And also, as an introvert, I mean, an extroverted person, you need to also be able to kind of sit back, right? and give others a chance. So you mustn't be someone who takes over the conversation, right? Because when you are in therapy, you don't want to take over the conversation from your client. You want to be able to give your client the space. So I think with masters, they're looking for people who are able to balance the two out. And I hope that kind of helps with that myth.
Yes, it does. Thank you.
You're welcome.
Okay, in the comment, oh, sorry.
Yes, no, go ahead, Sato.
Okay, in the chats, we have Salumi that mentioned a myth that was quite similar to Vichiro's, if I'm not mistaken. It says you're most likely to get accepted into the program if you have a traumatic, sad story, great chances, and then they put autobiography um, in brackets. So I think
Yeah.
they're just saying if you reflect on it well, the traumatic or
Mm,
sad story, autobiography, you've got
yeah.
high chances. Would you like to comment on that, or since you've touched on it, it's fine?
It's fine, and I will talk about it when it comes to the autobiography. I'll touch on that as well.
Okay. Then another one is by Nati that says that the myth is that your volunteer work needs to align with the category you are choosing. Is this true? And they said, i.e., if you're applying for clinical psychology, you need to volunteer at Hospivision, SADC, etc. And if applying for counseling, you need to do community work.
I would definitely like to believe that that is a myth because I feel like the whole reason behind volunteering is so that you, and which I will also talk about as well. But basically, it's for you to get an understanding of what it's like to be or to work with other people, to interact with people who are experiencing life challenges, whether they're traumatic or whatever it is. So I think that it definitely sounds like a myth. I don't necessarily think that you need to align it with the category that you're in, but just have volunteering experience so that you know what it's like to work with people, you know what it's like to hear something that is traumatic and then have to go and process it afterwards. You know what it's like to handle and contain, somebody's emotions, and feelings and thoughts, right? So I think that's the whole idea behind volunteering. I don't necessarily think that you have to align it with the category that you want to be in. You can if you want, because I feel like it gives you greater exposure to what you'll be dealing with or managing in clinical psychology or counseling, but just have volunteering experience.
Okay. Then the last myth we have in the chat says you are less likely to be accepted if you do not have the finances to fund your degree and living expenses. Is this true?
Definitely, I don't think it's true, because what if you have to go to another province? I remember during my master's we had to travel to schools and I didn't have a car, so that wasn't like a factor. As long as I knew how to get there and we kind of rode with, the other students who had cars. So I definitely don't think finances is like a factor because they do offer, I mean, okay, Free State does offer, when I was studying, a departmental bursary, so that helped as well. But finances, I think that they would definitely be discriminating if they don't take you based on finances. I mean, I feel like they would ask, how you're going to cover yourself. Maybe if you had a job before and now you have to quit your job because you have to come and study full time. So they might, inquire about that, what it's going to be like for you. Are you going to be able to manage? But I don't think they would not take you because you are not working or you don't have the funds. Okay, so that sounds like that is all of the myths. Thank you guys so much, for sharing. I think another myth that I used to hear a lot before I applied was that if you are young, they don't take you. They only take people who are older. And as I said, that I was about 22 when I got into masters. So I feel like it depends on the panel when it comes to that myth, and what it is that they're looking for in that year. So moving on to the activity. So if, maybe one or two people can share, and remember I said that, yes, okay, it's fine to say that you want to become a psychologist because you want to help people, but I really want you to then dig deep and understand and provide like a more in-depth like reason why you want to become a psychologist. So why do you want to become a psychologist? And I'm not asking like category stuff like clinical or just general. Why do you want to become a psychologist? If anyone is brave enough to share their reason. Hmm. So it looks like nobody wants to share, or is there any comments in the chat, Tato?
Currently, no.
Okay. Okay, that's fine. That's definitely fine. I think it's something that you can maybe kind of sit with and think about, what is the reason, or maybe you, by the end of this session, you'll have an answer as to why you want to become a psychologist. But I definitely think that before you start your applications, already have a reason as to why, and it needs to go beyond, as I've said, I want to help people. Like, truly, why do you want to become a psychologist? Is it because you've seen mental illnesses and the destruction that it can cause around you when there is no professional who comes in and helps the individuals? Is it because you have experienced mental illness yourself? So just have a reason, a more in-depth reason, that helps you to understand why you want to become a psychologist. So, and that is part of self-reflection. You'll see that part of my objectives is talking about self-reflection, and all of the questions that I'm asking everyone here is for you to sit back and to really think, and to understand and to have insight into yourself, which is what self-reflection is about, right? So this is basically something that you can use, like that you can take as homework. So this is your homework. Why do you want to become a psychologist? Beyond the reason of I want to help people, why do I really want to become a psychologist? Because trust me, that's a question that you will get asked, during selection week as well. And the panel definitely is not looking for I want to help people. They will probe you. Tato?
I wanted to maybe ask the question of, since it's given to us as homework, right? So we would
Mhm.
find different ways to reflect on it. What would you advise as sort of like the reason, or what would you advise against when it comes to answering the question or reflecting on the question of why one would like to become a counseling psychologist? Would there be any pointers to advise against?
Yeah, I think number one, definitely being surface level when you're answering that question. Number two, trying to tailor it to the category that you want to apply to, right? Because if you don't tailor it, then it's going to look like you're confused, right? So if you want to become a clinical psychologist, try and tailor your answer to fit, sort of the description of what a clinical psychologist does. Same with counseling psychology as well, right? So those would be my tips. Don't be surface level with, answering the question, and try to fit it into the category that you want to specialize in. Okay, hopefully that answered your question, Tato. So next I'm going to be speaking. So I'll be speaking about the different psychology categories. But first of all, some background information. So all the categories except for research psychology require a registration with the HPCSA as an independent practitioner once you have completed and passed your board exams. So when it comes to research psychology, as I mentioned here, that you can choose to register. So some research psychologists, they choose not to register with the HPCSA, and some, because of job opportunities, they choose to register with HPCSA. But all of the categories, so your clinical, your counseling, your industrial, your neuropsychology, your educational, all of those 5 categories, they need to register with the HPCSA. So when it comes to your studies, it's 1 year of coursework with dissertation. With research psychology, you can choose between 1 year of coursework with dissertation or just do a dissertation by itself. And then after you've done your 1 year coursework, then you then complete an internship at an accredited internship site. So majority of the time, universities, especially for clinical psychology, they will place you at an internship site. However, if you don't get placed at an internship site, just know that on top of, all of the work that you have to do during your master's year, you're going to have to find the time to apply to internship sites, and you can find all of that information in terms of which internship sites are accredited on the HPC website. Otherwise, your departments, the Faculty of Psychology, will also share, internship sites that have opened with you guys. So yeah, so you apply and then you go for your interviews, and then once you're selected, you can then after you've completed your M1, you can then go complete your M2. And then there is community service. This is only applicable for clinical psychologists, and they only do community service after you have completed your internship and you've written your board exam. So ComServe, you've completed your internship, you've also completed your master's degree as well, meaning that you have graduated from your master's degree and you've also written and passed your board exams. That's when you can become a ComServe. And then after ComServe for clinical psychologists, then you can only register as an independent practitioner. And then when it comes to board exams, so you only write your board exams after you've completed your internship and completed your master's degree, which I think is very important for everyone here to know that you are only allowed to write your board exams if you have submitted and completed your dissertation and you've completed all the requirements for your M1. You don't necessarily have to have graduated, but your dissertation needs to have been submitted and assessed, and you've received all the comments and you've taken back, the critique that they've asked you to fix or whatever it is, and the department has said yes, you can go and graduate. That's when you can write your board exams. I think they do have some sort of leeway. If you've completed your master's degree and you're still in your internship year, you can write your board exam, I think, if you've got 3 months left of your internship year. So I just want to also add that if you have completed your M1, you've completed your M2 as well. However, you haven't completed your dissertation and you are registered, because when you're going through the process, you're gonna first start off being registered as a student psychologist, and then you're going to be registered as an intern psychologist. So if you've completed your internship and you still have your dissertation left, um, then so yeah, you still have your dissertation left, and the following year you're still going to be registered as an intern psychologist with HPCSA. It's important to remember that you still have to pay your annual fee, because during internship you pay like an annual fee of, I think, about 800 or 700 rand. I'm not sure how much it is right now. So if you're still registered as an intern psychologist, even after you have finished your internship, but you're still waiting for your dissertation to be marked, or you're still waiting for your dissertation to be, you're still doing the write-up of your dissertation, you still have to pay your annual fee. And that's like a really important fact to remember, because if you don't pay your annual fee, the HPCSA will remove you from being registered or from the registry. So yeah, I think please note that down, that you need to pay your annual fee. Any questions so far?
There's nothing in the chat.
Okay. So we're going to look at the different psychology categories. So the first one is clinical psychology. So what they focus on is basically diagnosing, assessing, and treating mental disorders. So clinical psychologists mostly work with individuals with psychiatric or severe psychological disorders, meaning individuals who have severe depression, individuals who are diagnosed with bipolar and they are psychotic, meaning they're either experiencing mania or a depressive episode, individuals with schizophrenia who are experiencing, a psychotic episode. So those are the type of clients that clinical psychologists usually work with. And in terms of their work setting, they usually work in hospitals like psychiatric complexes or institutions. Clinical psychologists are also found in clinics. They're also found in correctional centers because, as you know, correctional centers, some of the offenders there sometimes have personality disorders. And you can also find clinical psychologists in private practice as well. So it's best fit for individuals who want to be able to assess and treat severe psychological disorders. Because, as I mentioned, the clinical psychologists mostly work with severe psychological disorders, right? So if you have that love and that passion for working with individuals with severe psychological disorders, then clinical psychology is for you. And then moving on to counseling psychology. So counseling psychologists, we mostly are there to kind of promote well-being and personal growth. So we mostly help individuals who are going through maybe developmental challenges. For example, adolescence, we know that a lot goes on during that adolescence year where you are trying to figure yourself out, you're trying to find your likes and your dislikes. And that can be a very challenging year. Also, another example would be maybe moving from high school to university. That's a big transition, and sometimes, students struggle with that transition and struggle with adjusting to university life. So those are the type of things that we work with, because we want to promote well-being and personal growth. However, I do want to add that counseling psychologists, educational psychologists as well, we are able to diagnose, assess, and treat mental disorders as well in the same way as clinical psychologists. It's just that our level of disorders is often from mild to moderate. So if somebody presents with severe, depression, then we'll often refer out to either a psychiatrist or out to a clinical psychologist because that's their scope of practice. But if somebody presents with mild depression, if they present with moderate depression, then we can often work with them in therapy. So another thing that we do as counseling psychologists is career counseling because, as you know, most of the time, it's difficult to choose the type of career that you want to go into. Or if you're working in a university setting, you often find students who have chosen a degree, but they feel like that degree is not suitable for me. I don't want to do accounting or I don't want to do law. So then we come in and we provide career counseling by asking about their interests, their subjects, and then we can also assess. So there are quite a few assessments that we use, to assess someone with career counseling. So the type of clients that you often see as a counseling psychologist is individuals facing life challenges, for example, grief, trauma as well, and adjustment issues as well. Other life challenges is maybe moving from one province to another, that can cause a lot of, distress in an individual, losing a job, the loss of a relationship. So those are the type of issues that you often come across, as a counseling psychologist. Even maybe as I said here, the type of work setting that we work in is hospitals, dealing with, patients who have stroke or cancer patients, hearing the news that you have cancer is not an easy thing to hear, that can often cause anxiety or depression in someone. So we help individuals in that situation as well. So we often work in schools, universities, private practice, and correctional centers as well. So in terms of correctional center, I think, you know, when you're outside, you have freedom, but in a correctional center, you have a loss of freedom, a loss of autonomy, because now you have someone who is telling you what to do, when to do it, and how to do it, So there's adjustment processes as well. So that's where we fit in terms of that setting. So if you are someone who, wait, let me just move this. So if you are someone who wants to work with individuals experiencing developmental and adjustment struggles, then counseling psychology is probably for you. If you're someone who doesn't see themselves in a clinical setting, working with severe psychological disorders, then counseling psychology might be something that you think about. And as I mentioned, counseling psychology includes career counseling as well. Then with educational psychologists, they often support learning and development because most of the time, educational psychologists, their work setting is usually schools and departments of education, and they can also be in private practice. But majority of the time, educational psychologists, they work with children in schools, children with learning difficulties, children with emotional difficulties, so children who might have a diagnosis of ADHD, ADD, or emotional difficulties like oppositional defiant disorder. Those are the type of clients clients that educational psychologists often see. So you really need to have a passion about education and children. I definitely cannot emphasize that enough if you want to work, if you want to become an educational psychologist, because those are your main clients. And then we have research psychology. So research psychology, its main focus is to investigate human behavior scientifically. I often say that research psychology is often for people who love psychology, but they don't see themselves in a therapeutic setting. They don't see themselves sitting across clients and trying to understand the client's problem. They're more like, investigating human behavior. They see themselves in that type of setting. So their clients, it's usually research participants, and the work setting is universities, research organizations, and NGOs. So if you are passionate about behavioral research, then research psychology might be for you. Then you have industrial psychology. So the focus is to enhance workplace behavior, and the clients are usually your employees, your HR teams, and organizations. So it's basically to, you work with workplace dynamics, ensuring that there is optimal, the work environment is optimal enough that people can come in and work to their best potential and their fullest potential. That's what industrial psychologists usually do, and they usually work in governments, corporates, and HR firms. And then lastly, which is a very new category, it's neuropsychology. And with neuropsychology, you often are needed to understand how brain functioning affects behavior and cognition. So you work with clients who have brain injuries, dementia, learning disorders, epilepsy, stroke, and so forth. And your work setting is usually like hospitals, rehabilitation centers, medical, legal, or forensic settings. And I said, think RAF, because when it comes to RAF, there usually needs to be like an assessment done by a psychologist. So neuropsychologists are usually the ones who do that. I mean, neuropsychologists and clinical psychologists as well. I think counseling psychologists as well can offer assessments for RAF. You can also be in your own private practice. So if you are passionate about brain functioning and cognitive rehabilitation, then neuropsychology can really be something that you look at. And as I said, that it's a really new category for the HPCSA. And I think it's only UCT that provides the neuropsychology masters, but you might need to kind of check that out for yourself. Any questions?
So far, there is a question in the chat from
Mm-hmm.
Linogushe. It's saying, can clinical psychologists also deal with children and adolescents as a niche?
Yes, yes. Clinical psychologists can see children and adolescents and adults, same as counseling psychologists, we see children, adolescents, and adults as well. So, my question is, which category do you think fits you? So now that I've shared, okay, and Tabi saying,
With me, I do think both clinical and counseling can do for me.
mm-hmm,
Um, I don't know if you want me to, say why, but yeah, as you were speaking, I did also realize that I've always thought that I'm much more of a clinical person, but I've
mm-hmm,
recently learned that I can also do counseling.
yes,
Yeah.
yeah. Okay, so you're gonna have to probably sit down and think which category you're going to be applying for when you are applying for your master's. It's a hard choice. It definitely is a hard choice, but you have to really kind of like sit and say, where do I fit? Do I fit in a hospital setting, with psychiatric um individuals who are like experiencing severe depression and psychosis probably, or do I fit in a setting where I'm dealing with grief, I'm dealing with trauma, I'm dealing with developmental challenges, I'm dealing with life challenges, I'm helping people grow, develop personal growth. I mean, clinical psychologists, they do that as well. But as I'm saying, majority of the time you find that clinical psychologists are in hospitals or they're in clinics. They're dealing with like severe disorders. So it really is something for you to think about. I see another hand. I'm only seeing MM here. So Motlale Pule, please, you can unmute. Okay. Lindo Kuhle.
Okay, can you hear me?
Yes, I can.
Oh, so my question is, I wanted to ask about you were talking about niche, right? So I want to ask like, do you have to like apply choose a niche when you're applying for your master's, or like can you provide more clarity regarding that?
When you speak about niche, are you speaking about the different categories?
Yes. Like
Yes. So when you are applying for your master's, you either apply to clinical, or you apply to counseling, or you apply to industrial, or you apply to
oh
educational. Yeah.
oh no, I wanted to ask about like specifically like what you just said of maybe let's say my niche I'm specializing in grief or type
Mm,
of disorder. So I
mm.
wanted to ask more about that. Yeah.
No, no. When you're applying for your master's, you're not applying to a specific niche. You're just applying to a clinical psychology program. It's only after you have finished and you're like an independent practitioner that you can say, "Oh, okay, I wanna specifically focus on working with individuals who have grief or who have experienced trauma like sexual assault, or I wanna specifically work with men, more in my private practice. So you can only have a niche after,
Oh,
you
okay.
know.
Thank
Yeah,
you.
yeah. I think maybe in your research you can focus on a niche that you're interested in. So in your research, if you want to focus on trauma, you can, do that in your dissertation. But yeah. when you're applying, it's just for clinical psychology. Any more questions?
Okay, there's a question here from Tlalepule. It says, I had a question on how to go about selecting a category when an individual, okay, my apologies, let me start that again. I had a question on how to go about selecting a category when, as an individual, you identify with two categories, but the comments you gave to the first question covered that. Thanks.
Okay.
So I guess it's answered.
Okay, that's fine. Yeah, it's difficult to choose a category. But yeah, at this stage, you should have an idea of what it is, that you, or which space you see yourself in, whether it's the clinical space, whether it's working with children, back to self-reflection, you're gonna have to really sit and be honest with yourself, you know, outside of the money. I know that clinical psychology, like people are always saying it's got more money than counseling or educational. So outside of that money, because this is the career that you're going to be choosing, this is the career that you're going to be working in. So outside of the money, do you see yourself um, working with severe psychological disorders, or do you see yourself working with more developmental or life challenges, or helping individuals with adjustments, or do you see yourself working more with children or in an organization, so you're really going to have to sit and gain some insight into yourself and be honest, with yourself in order to decide which category you think fits you. Okay. Oh, I could have just minimized it. Okay. So then now we're looking at applications, right? So what is the panel looking for in your application? Okay. So number one, they want to see, do you understand the demands of the profession? And this is why volunteering is so important. I know that's a question that often comes up. Should I volunteer? Is it important to volunteer? Because volunteering gives you experience. It gives you experience of what it's like to hear people's stories, which is basically what you're going to be doing as a psychologist. It gives you an idea of what it's like to work with individuals who've experienced trauma, who are going through really difficult moments in their lives. And it also gives you an idea of saying, okay, I can work with someone with, a trauma, and I can listen to somebody's trauma, and I can, sit and be empathetic, to someone who's experienced something that I've never experienced, I could have never thought, I would experience, So volunteering is so important, as I say here, because it the panel is like, okay, this person understands the demands of, being a counseling psychologist or being an educational psychologist because they have interacted with people. They know what it's like to interact with people, and they know how difficult it is, to sit with somebody's emotions and to hold space for another person. Maybe not obviously at the capacity of a professional psychologist, but you know what it's like to do that. So volunteering is extremely, extremely important, and in your application, obviously you're going to add, that experience that, okay, I have experience volunteering and this is what it was like for me. I know when I was doing my honors, I volunteered at Chalk. So Chalk is it's part of cancer. So it's an organization that helps little children who have cancer and their parents. And that was extremely difficult, just to see, young people suffering like that. And I reflected on it, that I developed like so much empathy, especially for the parents. And it was so hard to see, kids in that situation that sometimes it would make me so sad and I would cry about it, So then when you're writing about your volunteering experience, then write about, what it is that you feel, when you are in that situation and how do you overcome? Like, what is it that you use to cope? Because that's really important, because when you're a psychologist, you're gonna hear, somebody's story that really affects you. And you will need to be able to cope. Coping mechanisms are really important in the psychology profession. So yeah. That's number one. Also, they're looking for emotional maturity, and you need to have insights into your own self. That's why therapy is often recommended. That's why, people always say you need to be in your own personal therapy, right? Because when you're in therapy, you're able to understand certain aspects of yourself. You're able to understand, oh, this is something that I never thought affected me, but it actually is affecting me. And they're looking for somebody who's emotionally mature, meaning somebody who's empathetic, somebody who's able to put themselves in other people's shoes, which is, something that you learn when you're volunteering, So emotional maturity, psychological insights. I think that's also probably why, when you're writing your autobiography, you often share, experiences that you've gone through yourself. And when you're sharing those experiences, you're reflecting also. So you're not just sharing just because you're sharing because number one, you're showing, okay, I have insights into myself and I have insight that okay, I've experienced things in my life that have shaped who I am, and this is how I've overcome, these things. Or, yes, maybe this thing is still hurting me, and I'm in therapy, for this thing, and I'm working with, a therapist, and, back to overcoming. And this is what I've used. I journal, sometimes when I'm feeling sad, or I take a walk, or I have a lot of social support, so that's what they're looking for. And they're also looking for resilience. I think resilience is very important, especially for your M1 year. M1 is very challenging. It's also very demanding, There are people who drop out of M1 because of how challenging it is, So resilience is very important to showcase that as well. They're looking for people who are empathetic, back to volunteering again, and people who are committed. They're also looking for team players. Because masters, it's like 6 or 12 of you guys, and you need to be able to you know, bounce off, your ideas, and you need to be able to work, with other people around you, work with, clinical psychologists, work with your classmates who are educational psychologists, work with, if it's just counseling psychologists, you need to be able to work with your colleagues, in counseling psychology as well. And I think volunteering, helps with team player stuff as well. Also, being a team player is important for especially when it comes to clinical psychologists, you work in multidisciplinary teams. So if you're in a hospital, you're going to be working with a psychiatrist. You're going to be working with a doctor. You're going to be working with the nurses as well, who are all, there to manage the case. So being a team player is extremely important, and they're looking for people who are authentic. Remember that these are seasoned psychologists, so they can tell when somebody is faking it, and they can tell when somebody is not being authentic, and they can tell if something, you're still not over something. So I think for me, a tip that I always say with an autobiography is never share anything that you are not willing to talk about during masters. If you feel like something is too painful for you to talk about, then I highly recommend do not share it, because you will be asked about it. But when you are writing your autobiography, try to be as authentic as you can be, and also try to fit your autobiography into the specific category that you are going to be applying for. Okay. Yeah. So autobiography, what is it? So it's a personal narrative about your life, So basically you're detailing things, and it's not everything about your life, but you're detailing like the specific significant events that have happened in your life, like your background, educational details, volunteering experience, or any other experiences and personal development. So if you're someone who has created events, for mental health, write that in your autobiography as well. Any volunteering experience, if you've been a tutor, include that as well. Educational details, write about your academic journey, how has it been, and reflect, on your academic journey, what you found challenging, what you found rewarding, what it has taught you or what you have learned in your academic journey. So try to reflect as much as possible, and your background as well, right? Anything significant that happened, whether it's good, whether it's bad, and as I said, only write about things that you're willing to speak about, because as I mentioned, they will ask you about all of these things during selection week, yeah. So educational details, volunteering experience, background, experiences, and personal development. So don't be afraid to write about your weaknesses. I know we often want to write about our strengths as well. Also, those two are very important. Important to write about your strengths and your weaknesses, right? Because it shows that you have insight into yourself. So don't just write about your strengths, write about your weaknesses, write about things that you struggle with and how you're trying to overcome, or how you have overcome those weaknesses. So yeah, that's basically what your autobiography should focus on, because as I mentioned, they're looking for self-awareness. Are you aware of your strengths? Are you aware of your weaknesses? They're looking for people who have insights into themselves, that okay, this is how I grew up, and how I grew up has shaped me in this way. They're looking for people who are able to reflect critically on life experiences and maturity, because these are also the things that you're going to be looking for with your clients. You're going to look at, okay, is my client self-aware? Does my client have insights, into what is causing them this dilemma or the problem that they're facing? Are they able to reflect critically, meaning are they able to be objective and hold themselves accountable as much as they're holding themselves, as much as they're holding, other people accountable? Are they able to hold themselves accountable without putting or making themselves the victim, in certain situations, and maturity as well. So one thing that I did was kind of create a timeline of any significant events that happened in my life, and then I just chose, okay, this is what I want to speak about. This is something that I don't want to speak about. Like, for example, my mom passed away when I was young. So I decided to write about that because it was something that I had been actively working on. I had, grief strategies because I had been to therapy, and I had insights, into, okay, this is, that was a significant part of my life, and it has affected me in this way, but this is how I have, or how I've been, trying to cope with this event that happened in my life. So you can just create a timeline of anything that has happened. And if you're someone that, there's nothing significant that has happened in your life, write about that as well, share, about that, reflect on it, as well. So your autobiography, basically, they just want to know who you are. It's kind of like the gates into understanding who Utato is, because we've never met Tato, but let's understand, who Tato is. And also, it's like a way for them to kind of gauge, okay, is Tato a good fit? For the master's program, is she a good fit? Does she have insights? Is she self-aware? So that's basically what your autobiography is about. Any questions? Okay, but we'll take questions at the end. So in terms of the structure of your autobiography, number one is the introduction. So you're writing, who are you, I'm Snetemba Kwambe, I am from KwaZulu-Natal, I live in KZN, and then I think I wrote about my educational details. I studied at UKZN. I did my, undergraduate in the Durban campus, and then I did my honor, and I'm doing my honors degree, or I did my honors degree at Pietermaritzburg, UKZN. That's your introduction, just that, introducing who you are, and then you're writing about your educational details. Don't just go into writing about your life story, because they don't know who you are. First introduce yourself, then write about your educational details, and then you can go in with the life story. So you're writing about your life experiences, whether they are positive, whether they are negative. And as I said, write only the things that you'll be comfortable speaking about. If it's negative, then it should be something that you have coped with and you have overcome or are overcoming, or it's something that you are actively working on. especially in therapy, because it shows that you have resilience, you're able to bounce back, you know. So you write about trauma, loss, change. I had to, when I was doing my undergrad, I lived in Durban, but I had to go to Johannesburg, and it was really difficult for me, but I, made friends and I got along with my roommates and I adjusted to being in a new environment, so write about those things. And how these experiences developed your values, empathy, and insights, because experiences, they change you, they make you become more empathetic. Maybe experiences helped you change, certain values that you had. They make you gain insights into yourself with, oh no, I'm not someone who is very much flexible when it comes to change, or I can't adapt, as easily. So I probably, need coping strategies, I need social support, to help me adapt. I need to call my family, so yeah, that's basically like your life story. And any experiences that you have, volunteering, therapy, any events you've done, anything basically, that you feel like is going to add into your autobiography, you add it in there. And then obviously you conclude it, right? So introduction, life story, experiences, and conclusion. That should be the structure of your autobiography. And I cannot stress this enough. Do not write about anything that you don't feel comfortable talking about, because there is a high chance that they will ask you about that during selection week. So make sure you are comfortable. Whatever it is that you write, you are going to be comfortable with speaking about it. Okay. Okay, so we will just skip this activity, but I thought it was such a cool activity because it was one of the questions that I was asked actually during, it wasn't during the individual panels, but it was during like the group. No, it was a group question. If my life was a movie, what would the title be and why? What would be the plot or the most powerful moment? I think that's a good way to kind of, maybe if you have no idea where to start, this is a good question, to kind of sit and reflect on, how would I describe my life? What would be the plot? Then you're like, okay, these are the significant things that have happened in my life, or what would be the most powerful moments? Graduating was probably my most powerful moment. Becoming a psychologist was my most powerful moment. So I think this is a good reflection question that you can ask yourself if you're struggling to figure out what to write in your autobiography. Any questions before we move on?
I didn't know whether to share the question at the end or not, but then Lindo Kutle had asked the question on what increases your chances of getting accepted to masters, if I may ask. So that's his question.
So we're gonna go back to this. But also it depends on the panel. It depends on what the panel is looking for. But I think if you can show this in your autobiography, if you can show this in your application, then it might increase your chances. But it honestly just depends on the panel and what it is they're looking for, especially when it comes to selection week, right? Because you might have a good application, but when the panel meets you, they're like, we're not really sure. But if you can show that you understand, the profession because you've done volunteering, also when it comes, I'm not sure if, but applications, when I did applications, we had to have, they asked about some psychology stuff. So you can show that, okay, there's, a theory that you understand, in psychology, a therapeutic approach that you really like in psychology, you show emotional maturity, you show insight, you show empathy, I think that should set you apart from the other applications. But honestly, it really does depend on the panel. It really does depend on that, on them. So in terms of your research proposal, I'm not sure if my colleague Zeta is still here, but hopefully if there's something that I miss out on, she can help me out. If there's something that I don't explain properly, please, she must help me out. Research proposals. So the panel here wants to see what your research interests are. Linda Woodley, you were asking about niche. This is where you can then say, okay, maybe I like to work on trauma and this is my niche and I want to do my dissertation on trauma. So this is where the panel sees, okay, this is what this person is interested in and whether they align with the department. So it's important to do your research first before you decide on a topic. Go to the university that you want to apply at, and go to the Department of Psychology or the faculty and see what the lecturers or the professors or the doctors are researching on, and try to align your research interests to what they are doing. So if there's someone that's doing trauma, try to align your proposal to what they are doing. So your research interest must be in line with what the psychology department is doing. They also want to see your ability to formulate a research problem, your understanding of research design and ethics, critical thinking, and academic writing skills. So your research proposal, it's usually 2 to 3 pages. So the first part is obviously your title. An example could be exploring the impact of social media use on anxiety among UKZN students, right? So that could be your title, short, concise, straight to the point. It's not long, right? So that's what your title needs to look like. Then you look at your introduction and background. So brief context, because it's 2 to 3 pages, needs to be brief, brief context of the background issue. Okay, what is social media use? You're looking at what is anxiety. You're looking at, okay, why is the topic important? What value or contribution will it have to academic literature, psychology, or society? Why am I, wanting to understand the impact of social media use on anxiety, on anxiety among students? Because there's a study that has been done in the USA that shows that social media use affects students like this, affects students' anxiety like X, Y, and Z. So that's basically like your introduction and background. You're introducing the topic and you're providing like a brief background to why is this important, and what do other studies say about this, about social media use and anxiety. What are they saying overseas? But most importantly, what are they saying here in South Africa? And its relevance. And obviously, when you're doing your research proposal, try to use how do I say this? Try to use research that is recent, so don't look at research that is like 1999 or whatever, or even like, because I think research, you have to look at papers that are 5 years, right? So from 2020 up until 2025, that's like the window period. So yeah. And then you're looking at your problem statements or research questions. So what is the core issue that you are investigating? So these are your research questions. So you have your title, you have your introduction, now you need to come up with research questions. So what is it that I'm investigating? What is the core issue that I'm trying to investigate and I'm trying to understand here? So for example, what is the relationship between social media usage patterns and self-reported anxiety levels among university students? So that would be like a research question, right? Zintle, please feel free to jump in because I'm not good at research. I'm trying my best, but hopefully I'm explaining this properly. Yeah. And then your aims and objectives. So what do I hope to achieve by researching this question? Okay, I want to explore the relationship between social media use and anxiety. I want to identify whether usage patterns, duration, content type predict higher anxiety. I want to inform wellness interventions for students. So from my understanding, your objectives need to kind of link back to the research question that you posed. So it shouldn't be so far from the research question because as we mentioned that the research question is the relationship. I'm looking at the relationship between social media usage and anxiety levels, right? And then my objectives need to reflect that research question. Okay. And then you have your literature review. This is where you're highlighting findings from previous peer-reviewed studies, any gaps, and where does your study fit. That would be your literature review, short as well. And then we're looking at methodology. So we're looking at the design. Is it quantitative, qualitative, or mixed methods? I think usually for masters, they ask you to choose one. You can do both, but I think for masters, you have to choose either quantitative or qualitative. And then sampling, who are your participants going to be? Obviously, my participants are going to be UKZN students, but am I targeting first year students? Am I targeting second year students? Am I only looking at postgraduate students, am I looking at students from humanities? Am I looking at students from the College of Law? So your sample needs to be really specific. How many and where will you get your sample? And what are some of the tools that you're going to use? Are you going to use surveys, interviews, assessments? What is it that you're going to do to kind of find that relationship between social media and anxiety? And how would you collect your data, which is basically goes back to the tools. Are you going to use assessments? Are you going to ask for interviews, group interviews? What is it that you're going to do? Or how will you be collecting your data? And then obviously ethical considerations. So you have to look at informed consent. You have to look at confidentiality, and you have to look at ethical approval from institutions and any limitations that you think you will encounter. So in terms of informed consent, how will I get my participants to agree to doing the study? Am I going to have a sheet, a piece of paper that speaks about informed consent, and then participants have to sign it, before I can interview them? How am I going to maintain confidentiality? I'm using interviews, and obviously I'm going to be recording my interviews. So how will I make sure that nobody gets a hold of my recordings? Where will I store it? And obviously ethical approval from institution. That's pretty self-explanatory, that before you kind of conduct your study, the university has to agree and say, yes, you can conduct the study. And usually the department, usually they help with getting ethical approval and any limitations, so limitations might be lecturers might not want to have me come in and give out studies, during their class time. So how will I overcome, those limitations? So that's what you need to put. And then outcome or contribution. So what do you hope that your research will show or contribute? So that is the research proposal. Any questions on that? Okay, no questions. So my do's and don'ts. So do with every single thing that you are going to be writing, every piece of paper that you're going to be writing, please check your grammar, your language, and structure of your written work. Don't submit work that has grammatical errors. Don't submit work that, the paragraphs are too long or the paragraphs are too short. You cannot use like just slang in your application, because your paper application is a representation of who you are, as a person. That's how, the panel is going to know, okay, this is Lindo Guhle, okay, this is Utato. So try to represent yourself as best as you can. So check your grammar, check your language and structure of your written work, make sure everything makes sense, your sentence construction, check what the university's research focus is, and if you'll be able to get a supervisor, because trust me, you don't want to have, a research proposal. Now you are in, the master's program and you don't have a supervisor, because that is just going to be very terrible. Be in your own therapy. I would highly recommend this. If you can afford therapy, be in therapy. If you are still a student, student support services are free. Be in your own therapy, because therapy helps you with insights. Therapy helps with emotional regulation. And also I feel like therapy is important because then you also know what it's like to be a client, because we're expecting people to come in and be vulnerable, and that is so difficult. So if you are in your own therapy, then you also have the insight that, man, this is such a difficult thing that I'm asking, my clients to do. I'm asking my clients to be vulnerable. And going back to what I said, that this is what the panel is looking for. The panel is looking for someone who understands the demands of the profession. So now you have an understanding that, okay, being a client is not easy. Being a client is absolutely not easy. Being in my own therapy, being vulnerable is not easy. So then as a psychologist, I need to make sure that I'm able to build rapport with my clients by being warm, by being empathetic, by being non-judgmental. So being in your own therapy absolutely helps. Volunteer, as I said, volunteering, you are like, it's kind of like a preview on what it's like to work with people, and what it's like to manage other people's emotions, what it's like to hear something that stakes you up and then have to, go back to your own normal life, and have to be all snare after hearing something that was also like traumatic and terrifying to me. Now I have to cope with it, right? So volunteering helps you get a glimpse, into that. Do try to diversify your referee list. I think it's part of my don'ts as well that when it comes to referees, try as much as possible to ask people that know you, so your lecturers, if it's like a lecturer that you've had contact with and they know who you are, you can ask them because then they can comment on, your academics and, your ability to handle like the academic pressure there, you know. Don't ask someone that barely knows who you are, you know. Um, and don't ask someone that you don't trust to be honest as much as they can when it comes to that report. Don't ask someone that you don't trust in general, someone that you feel like they might get the referee report and then misrepresent you, because referee reports, they hold a lot of weight, because basically they are the word is not coming to me, but your referee report is extremely important, and do try to diversify it if you are able to. Um, okay, Vuchilo has a question.
Oh yeah. Regarding going through your own therapy.
Mm-hmm.
I've never been in a long-term therapy, but always when I'm experiencing some psychological distress, or maybe if I'm experiencing some life challenges, I do consult with SADA. I know it's not a long-term therapy. It's
Mm,
just a 15 minutes thing or 20 minutes thing. So I wanted to ask, can I add that on the application when they ask about the experience with therapy? Can I
yes,
mention?
yes. You
Okay,
definitely can. You absolutely can. Because SIDEC also, here at Student Support Services, we do often say to students, because they have a 24-hour line, so we do often give them the numbers of SIDEC, as an alternative, right? So you absolutely can add SIDEC as well, because you have experience of what it's like to share your story and share your struggles with somebody else who doesn't know you. And you probably know how difficult that is, to be open and honest. It's difficult to seek help, it's difficult to say, hey, I'm going through something and I'm not okay. So you have that experience of what it's like, for your clients to book a session and come in here and say, I'm not okay. So definitely
okay,
do add it. Um,
okay,
okay,
thank you.
you're welcome. So do reflect on what you have learned from personal experiences. As I've explained, it's you have to critically reflect, and it shows insight as well. Show understanding of psychological theories or psychology. That is so important. Psychology in the South African context, we have African psychology, so try to bring in some sort of South African context when you're writing about psychological theories, if there is a need to do so, and get feedback of your written work if you have to, get someone you trust to read through your autobiography, to read through your psychological concepts if they've asked you to write something related to psychology, and ask them if they understand, what you have written. So those are my do's. And my don't complete your application last minute. Don't ask people to be your referees last minute, especially when it comes to lecturers, because they are busy, they are inundated, and they will probably forget, and now your application is sitting with no referee, or there's a referee that has not submitted, right? And that, kind of disqualifies you, because if they say they're looking for 3 referees, then they're looking for 3 referees, right? So don't ask people to be your referee last minute. Give them time. Even share, this is the closing date, and do like weekly checkups. Hey, have you submitted? Hey, when are you going to submit? So make sure that they do submit their referee reports to the university. And don't apply because everyone else is applying. I want you to really sit and say, is this the next step for me? Right? Is this what I want to do right now? Or do I feel like I need to take a break? Or do I feel like I'm not sure? I'm still questioning it. Obviously, you won't be 100% sure, but there also needs to be something inside of you that says, yeah, this is a good step for me. This is what I want to do now, So really just try and sit and think, am I applying because this is like a natural step for me? This is the natural next step, or am I applying because there's so much pressure and everybody's applying to masters, and now you end up choosing a category that you don't even like, So truly take the time to sit and say, is this something that I want to do right now? And as I mentioned, don't exclude your weaknesses. You can frame them as opportunities for growth. Maybe you struggle with public speaking. You have to do a lot of public speaking and presentations in masters. And maybe it's like, okay, master, I've developed it by doing tutoring. I'm trying to get out of my shell, and masters also is going to be a good opportunity for me to do that through the presentations and having to present myself professionally. So don't exclude your weaknesses in your application. And then this is my prep list. So create a list of all the universities you want to apply for, including the closing dates and application fee. See what the requirements are, and see if you fit into that requirement, especially when it comes to academic requirements. I know that some universities want 65%, some universities want 70%, right? Contact everyone you want to be your referee and email them the referee reports, including the deadline for submission. And as I said, do weekly checkups and follow-ups, and make sure that they have submitted their referee reports, and set time to complete your applications. Definitely do not try and do it last minute. It is not going to work, because applications, it's a lot, so have enough time to complete your applications, certify your documents, and find out what the courier fees are if you will need to send your documents to the Free State, for example. So that's basically my prep list. And self-reflection, right? So what is self-reflection? It basically is your ability to understand your inner world. Basically, so your inner world is like your thoughts, your feelings, your emotions, understanding your own biases in a non-defensive stance. You don't want to, because if you're defensive, then you're not going to understand anything. Instead, you're going to just avoid it, right? So that is what self-reflection is all about. It's basically your ability to be able to sit with yourself and say, okay, in this situation, Snare, you could have honestly acted better. And why did you react like this? Oh, it's maybe because this is the only reaction you have seen, played out, or this is the only reaction or coping mechanism that you have, when it comes to situations like this. Okay, so then what is it that I need to do, Yeah, so you need to be able to understand your inner world, because it's self-reflection is needed, especially if you like clinical or counseling, or even if you're educational as well, because you're gonna have to sit with yourself and say, okay, how was that session? What did I ask correctly? I don't want to use the word correctly. Or what could I have done better in that session? Or how did I feel? How did the client make me feel? Or what is it that I'm feeling right now? Um, Maybe it was a suicide case. I know for me, like suicide cases really get to me sometimes. So I need to like kind of sit down and reflect, okay, what is it? Why am I feeling like this? Oh, it was a suicide case. Okay, how am I feeling? And sometimes clients make you feel defensive. So then you need to understand, why do I feel like this? Oh, it's because they're triggering something from my past. That's why I feel like this. So self-reflection is really important. That's why I had all of those questions. Why do you want to be a psychologist? Which category fits you? In order to understand the category that fits you, you have to understand yourself and the type of person that you are and your own personality, and your own likes and your own interests and the type of people that you want to work with, So that's how you can choose that, okay, this is the type of category that I want to be in. In order to write your autobiography, you have to sit with yourself, understand your emotions and how you felt in certain situations, how you could have reacted in a better way. What have you done? Have you been avoiding instead of facing things? Are you someone that avoids and runs away? And then you have to ask, would I want a client to do that? Would I want a client to run away, or do I want my clients to face, their problems? So why do I run away? So yeah, self-reflection is really, really important. Um, yeah. So lastly, and this is something that you can do by yourselves, since I'm looking at the time now and you still want to have some Q&As. So what qualities or characteristics are you bringing into your journey of becoming a psychologist? So what strengths, what weaknesses, are you bringing, and what is holding you back? What is holding you back from applying? What is holding you back from reflecting? What is holding you back from anything, you know? Or what do you think will hold you back in your journey of becoming a psychologist? Yeah. So that is it from me. Any questions?
Yes, we do have questions in the chat. This is from Nati. It's saying, Snetemba, you mentioned you're from KZN and went to UFS for your master's. Given that
Yes.
Sesotho is a dominant language in the Free State, did your KZN background not count against you? Or did you already know how to speak Sesotho when you went to UFS?
I did not know how to speak Sotho when I went to the Free State. It didn't really count against me because I also had this question can also be posed to like Indian people and white people who cannot speak, sometimes they can't speak indigenous languages or Nguni languages. So it really didn't count against me. Yes, it's difficult, right? Because I think what they used to do in my department is that if they would look for children who speak Zulu or children who speak English only, and those would be my clients. So it's challenging when it comes to clients because some clients want someone who can speak Sesotho because it's more comfortable to speak Sesotho and they can express themselves better. But I think the departments really try to kind of work around that because I think they were also looking to diversify their candidates. So it really didn't count against me. And then another option that a department can do is have a translator. So have one of your colleagues sit in the session and translate for you the session if you struggling with the language.
Okay, thank you for that. A follow-up question by Nati says also, Does your dissertation topic influence the internship sites you get accepted in?
No, it doesn't. I did my dissertation on offenders, and I went to a student support services internship site. So it has no influence because it's your dissertation, it's your interest, and it's what you want to do. Internship sites, they do ask about it sometimes, but it's not in, oh, okay, this is what we're going to base, choosing USNE for this internship. So it has no bearings on the internship side.
Thank you. A question by Venolia is, regarding the autobiography structure, you mentioned that we can also reflect on our voluntary experiences. I just wanted to clarify, wouldn't that be repetitive considering that the VITS application already includes a separate essay question specifically asking us to reflect on our voluntary experience? I'm asking this for VITS application only.
I don't think it shouldn't be repetitive, right? I know that they have a section on that, but basically your autobiography, you're writing about yourself, your own personal experiences. And if it's like an important thing for you to say in your autobiography, and maybe you can say it in a different way to the volunteering experience, maybe in the autobiography you have a chance to kind of expand on it more than the parts where they ask about the volunteering experience. I think you should add it because it's part of your life story, it's part of your own personal experiences, and it's part of the reasons probably why or the things that have contributed to you wanting to become a psychologist. So yeah, I would say write it in both. Anyone else have questions?
Hi, Sneh.
How are you?
I'm good, thanks. How are you?
I'm good, I'm good.
I joined at 4.
Oh, okay.
Yes.
Vuchilo, I hope I'm pronouncing your name correctly, because
Okay, this will be my last question. In regard to with autobiography, some universities have a words limit. Like they will tell you that they only need 600 words
Mm.
maximum, and so you have to summarize your autobiography is if your words are above the number that they are looking for. So will it be okay if I I don't include intro introduction in my autobiography? Let's say maybe I just start talking about my experiences.
Nope. Nope. I would definitely not recommend you doing that because then who are you? They don't know who you are. It's just, this is my life experiences. When you're meeting someone for the first time, you introduce them yourself, like, hi, my name is Nitemba, and this is who I am, and this is my educational details. You don't just, go into it. So I would not recommend you not putting in the introduction. Even when you're writing essays, you have to put in, introduction, because I feel like they're also looking at that, like, how are you structuring your autobiography? Are you introducing yourself? Is there some sort of conclusion? Is the language good? What, like, they're looking at that also. As I said, like, your autobiography, you're representing yourself, so make sure that you represent yourself well.
Okay, thank you.
I kind of saw a thing that said we have 5 minutes left. Yeah, so I just really want to say good luck um, to everyone here. Good luck for your applications, even for selection week as well, because we're putting it out there that we're going to get into selection week. And I really do hope everything, goes well and you do make it. I'm looking forward to seeing some of you guys as my colleagues, in the near future. And If you have any questions, please feel free to go to Martha and then you can come to me because I don't know how you can contact me, but I'm on LinkedIn. I don't have any other social media platform. So you can contact me if you have any other questions. And yeah, I really did enjoy this session with you guys and I hope that it goes well. I really do hope that everything works out.
Thank you so much, everyone, for joining. Thank you so much, Sneh. I think your presentation was just so insightful. I can see. Okay, Linda Wutle has one last question. How can we find you on LinkedIn? I'm sure it's just in regards to your name. What is the name of your profile? If you could just share that with
Yes.
us, and then they know how to contact you.
Yeah, so my name is Netemba Kwambi on LinkedIn. That's how you can find me.
Okay, thank you. I think everyone got that. Great. Okay, so as we've come to the end of our session, I want to take a moment to sincerely thank each and every one of you for joining us today. Your engagement and participation made this an enriching experience, and we truly appreciate your time. We have shared links. I shared it earlier on in the chat where you can access the recording of the session and the first Masters Prep session we've had. So please feel free to revisit the insights shared today and continue your preparation journey with confidence. A special thank you to our speaker for her openness, authenticity, and for creating such an interactive and engaging space. We deeply appreciate the time and effort she put into sharing her knowledge with us. It has been very valuable. It's been an amazing time, especially at the very beginning of the session where you were just completely open about how long the journey actually took you and the challenges that you faced throughout. I think it is my very first time also coming into a session where somebody was that open about the challenges that they faced and how long it actually took for them to eventually become qualified. And it just shows that each one's journey is different, but at the end of the day, it will all happen. If the door opens, then you're definitely meant to be there. If the door opens, then you're definitely meant to embark on that journey. So once again, thank you all for being here. We wish you the very best on your academic journey, and we hope to see you at our future sessions. Please do follow the pages as shared in the chat. Follow Becoming a Psychologist. I shared the link. It's in an Instagram account, Yamatha Moahi. And then please also follow her on LinkedIn, where you'll be informed of any sessions that we are to have. I do see Martha's hand is up. She'll most probably wrap it up for us. Thank you from my side.
Thank you so much. Good afternoon, everyone. Thank you so much, Tato, for facilitating the session, and thank you so much, Sneh, for being such an open speaker in today's session and sharing your journey with the Masters Hopefuls. There is a question from a comment rather from Mamashu. Mamashu, you can go ahead, unmute, and share your insights with us just before we close. I'm so sorry about that.
Okay, thank you so much, Martha, and good afternoon, everyone. I'm just giving a little comment from the presentation where the methodology is concerned. But please note that I'm not really inclined with this, but I just thought maybe also this information could be helpful because as much as I don't understand how other institutions work, but I believe that the research is the research. During the presentation where the presentation was on methodology, I did not hear much of ethical consideration, and if it also have to form part of your proposal. where you indicate the ethical consideration and also the trustworthiness. But I believe as well that depends on the methodology that one uses, and maybe to just stretch yourself when it comes to that. The other thing that I did not also hear being mentioned is the inclusion and exclusion criteria. I had a part whereby the presenter spoke about the data collection and your population and whatnot, but you also need to check if why are you including this particular why are you including this particular group of people, or this group of, if you are doing interviews, of course, and why are you not? Like, let's say, for example, you say you are going to deal with 18 to 35, which according to our South African law, it's the youth of the country. But now, why are you excluding the elders, or why are you excluding the small children, and those kind of things? So one needs to also include that kind of information, so that you, when you are asked, then you are able to also back up your proposal if you have to do presentation before submitting for ethical clearance. That's all I wanted to add. Like I said, I'm not sure how other institutions work, but yeah, if it's something that was missed, maybe without with error on it, then you can also add that kind of information. But you will also have to check if the institution really need that kind of information or not, because I did research psychology, so you need to go as deep as possible. And for someone who is doing coursework and as well as mini dissertation, maybe it might be different. Thank you.
Thank you very, very much for sharing that. Thank you, highly appreciated. Ms. Martha, would you like to wrap up, or could we kindly say this is the end of the session?
No, there isn't anything from my side. Thank you so much, Tato and Snetemba, and to everyone who joined. Thank you so much for joining us today. We will be sharing the recordings as as Tato has indicated. So yes, I think that's all from me. Thank you.
Okay, thank you very much to everyone, our presenters, Netemba, and everybody. Thank you so much for the insight, the participation, the love, the support that you've been giving. We highly appreciate it. I would love to wish you a great, blessed, amazing day. And yeah, thank you very much. Till we meet again. So please keep up, follow, like, subscribe, do it all so that you have the latest information on when our next master's prep session will be. Thank you. Enjoy your day.